Hello everyone, welcome back to my YouTube channel Dr.Barki's Ophthalmology Tutorials. Today we will discuss about target IOP or the target intraocular pressure. So whenever anybody diagnoses a case of glaucoma, the first thing that comes to their mind is what should be the target IOP to prevent the further damage. So in this video we will discuss about what is target IOP and why we should calculate the target IOP, how to set the target intraocular pressure, and how to set the initial target intraocular pressure depending upon the various factors, which are all the cases where the target IOP has to be really low and where we can relax a little to have little higher target intraocular pressure. So without much delay, let's begin our video on target intraocular pressure. So you can define target IOP as the estimate of intraocular pressure below which the rate of disease progression is expected to be reduced sufficiently to minimize the patient's risk of further vision loss due to glaucoma. So there are less chances of damage to the optic nerve once the IOP is reduced to this target IOP level. Okay. Why one should think about target intraocular pressure? Because the first thing is it encourages thoughtful appraisal of various factors that influence the future risk of progression. The second advantage is it allows efficient assessment of the patient IOP at each subsequent visit. So it acts as a parameter to assess ourselves that whether we are going in the right path, controlling the damage to the optic nerve. And even if the target IOP is achieved, the clinician must always evaluate the structural and the functional measures that are important in the glaucoma. It's not mandated that if the target IOP is achieved, the disease doesn't progress. So again, we'll have to remodify the target IOP depending upon the progression of the disease. How to set target IOP? So that depends upon various factors which include the damage which is there at the initial presentation to the optic nerve, the rate of progression of the disease, whether there are optic disc hemorrhages, depends upon the thickness of the cornea, is there a strong family history of glaucoma, and what is the age or the life expectancy of the patient. So one should keep all these factors in mind to fix the target intraocular pressure. So establishing a target IOP is part of the art of glaucoma management. After determining the target IOP, the clinician must decide whether to go ahead with the medical management or the surgical management. How to set the initial target IOP? So that depends upon various factors. Just like, is there only raised intraocular pressure, that is ocular hypertension, or is there associated optic nerve head damage, or is there associated visual field defect also? So if the patient has only ocular hypertension, means there is only raised intraocular pressure but the visual fields and the optic nerve are normal, then you can aim for target IOP of less than 25 mm or 20% below the baseline. The second category is there is mild glaucomatous changes, that is optic nerve head changes are present but the visual fields are normal. Then you can aim for less than 21 mm of intraocular pressure or 25% below the baseline. Suppose there is moderate glaucomatous damage, visual field changes in the one hemifield outside the central 10 degree, then you should aim for less than 18 mm of mercury of target IOP or 30% reduction in the baseline. If there is severe glaucomatous damage, that is visual field damage in both the hemifields and or are affecting central 10 degree, then aim for less than 15 mm of mercury of target IOP or bring the target IOP to 30% below the baseline. These are the various factors one should consider in fixing the initial target intraocular pressure. There are some conditions where the IOP has to be reduced till to the lower side. That is, if there is appearance of the new optic disc hemorrhage, the corneas are thin, history of rapid progression, or there is severe loss of vision in the fellow because of the glaucoma, there is family history of blindness due to glaucoma, and early age of onset of glaucoma. So in all these cases, you should really bring down the target IOP to the lesser level. And there are some scenarios where you can have little raised target IOP, like if the patient's life expectancy is decreased or the patient is having other comorbidities, and if there is history of acute optic nerve injury because of the raised intraocular pressure, history of stable or slowly progress, or if there is high central corneal thickness, then you can have little higher target intraocular pressure. So hope this video on target intraocular pressure is helpful to all of you. If you like my videos, please do subscribe to my channel. Press the bell icon for further notifications. Please do like and share my videos. Thank you so much.